We're pleased to be joined by Dr. Eric Thompson of Washington University to talk a little bit about his recent medulloblastoma trial, which we funded back in 2023, talking about two specific compounds and their access to the tumors and trying to cross some of the blood-brain barrier. With that, I'd like to obviously turn it over to you, Dr. Thompson, to talk a little bit about what this publishing, what it represents, an anti-cancer drug journal, and what this means for the community. So thank you for
Yeah,
joining us.
thanks very much, Keith. I appreciate the time. To provide some background, my lab had previously discovered that two proteins called ABL1 and ABL2 are likely very important drivers of medulloblastoma, particularly medulloblastoma when it disseminates throughout the nervous system. And as we know, when there is recurrence of medulloblastoma after initial treatment and when it disseminates, it's very, very difficult to treat. So we found that ABL1 and ABL2 are putative or potential drivers of this leptomeningeal dissemination process. There are, fortunately, drugs that target ABL1 and 2, but the most specific drugs don't reliably cross the blood-brain barrier and enter into brain tumors and tumors of the central nervous system in likely meaningfully relevant concentrations. And so this work, funded by the Cure Starts Now, was really looking to determine if there are ways to improve the efficacy of these drugs that target ABL1 and ABL2. Now, ABL1 and 2 are both substrates of a protein called P-glycoprotein. And P-glycoprotein is a very important protein that's expressed not only at the blood-brain barrier, but in tumor cells themselves. And what it does is it works to actively pump out therapeutics or drugs. And so what happens is when these drugs are pumped out of either the blood-brain barrier or the tumor cells themselves, they can't do their job to kill the tumor cells. And so we used a P-glycoprotein inhibitor called tariquidar to inhibit that drug efflux pump in order to make improve the efficacy of ABL1 and ABL2 inhibitors. One is called asciminib, and the other is called nilotinib. And basically what we showed both in animal models and in medulloblastoma cells themselves were several different things. So in our animal models, we showed that when you inhibit P-glycoprotein, that you get an increase in the total brain concentration of those two drugs, of asciminib and nilotinib. That the half-life or the length of time the drug stays in the body is increased when you treat with tariquidar. And the area under the curve, or essentially how much of how much total drug exposure there is increased by inhibiting P-glycoprotein. And so taking that into medulloblastoma cells themselves, when you pretreat the cells with P-glycoprotein, the cytotoxicity or the ability of asciminib to kill those cells is significantly enhanced. And so this finding has led to our proposal for a phase 0 trial, actually, of asciminib plus a different P-glycoprotein inhibitor that's approved actually already by the FDA for use in pediatrics to determine actually the real amount of asciminib that's available in brain tumors, including medulloblastoma. And then once we determine if our findings that we found in animals are applicable to humans, which unfortunately they aren't always, but we hope that they are, then if the results of this phase 0 study are successful, then we'd be looking at clinical trials, phase 1, phase 2 clinical trials of ABL1 and ABL2 inhibition for leptomeningeal medulloblastoma, both to treat it when it's there and potentially to prevent it at the time of recurrence.
That's fantastic news. I was going to ask you what's the next steps, but you've already
Yeah.
answered that.
Yeah.
And moving it to clinical trials. That's always been one of the challenges is the blood-brain barrier, and it's kind of neat to be able to find some way to be able to help cross that and make it more effective in that. So we congratulate you on your work, and congratulate you on your publishing as well. So thank you for all the efforts that you're doing for this community.
Absolutely, Keith. Thank you very much for the support.